Good morning, colleagues. Morning, Dr. Liru.
Good morning, Chair.
Good morning, Honorable Sine. Good morning, Honorable Clarke. Good morning, Honorable Mujadu.
Morning, Chairperson and honorable members.
Who else am I missing? I've got a lot of apologies for today. Thus far, those are the members that I can see. The others might be joining as well. Then let me welcome the team from the
Recording in progress.
Led by Dr. Pillay. And good morning, Dr. Pillay.
Good morning, Chair. Good morning to the members.
And then I want to also welcome all our visitors that I'll do at a later stage again. But you are all welcome. Can we then fly the agenda? Yes, this is the business for the day. We have the opening remarks, attendance register, then we'll receive the briefing. We are going to discuss and then deal with the item of minutes, and then we are going to close this meeting. Welcome, Honorable Shavangu. Honorable Shavangu, good morning. And Dr. Litla.
Good morning, Chair. Good morning.
And good morning, Honorable Letlape.
Good morning, Chair, and good morning to everybody else.
You're welcome. You want to move for the adoption of the agenda, Dr. Liro, or you've got something that you want to raise?
Morning, Chair.
Yes. Yes, good morning. I called your name. You might have been... Yeah. Oh, you're welcome, Honorable Clarke.
Thank you, Chairperson.
Thank you so much.
Thank you.
Honorable Mtongo. Honorable
Good morning,
Mtongo,
Chairperson.
good morning to you and welcome, Honorable Mtongo.
Thanks, Chairperson.
Thank you. Dr. Liru?
Thank you, Chair. My question has been answered. I just was concerned that when we started, we weren't quorate, and so I just want to make sure that we have a quorum before we start. But I think that we now do have a quorum, if that's correct. But perhaps the Secretariat can help us with that. Thank you.
Honorable Chira, good morning. Chirwa Mpongose, good morning, sir.
Good morning, sir, to yourself and colleagues.
No, okay, don't worry, Honorable Liru, we do correct without asking even the Secretariat. So the agenda is on the table. Can I get a mover and a seconder?
I'm happy to move for adoption of the agenda, Chair.
Moved by Dr. Liru. Dr.
I second, Chair.
Thank you so much, colleagues. Then the agenda is seconded. Can I get apologies? Secretariats, do we have apologies?
Good morning and thank you, Chair. I've received apologies from Ms. Kubmalo and Mr. Van Staden. I see that too, Ms. Trako has just joined the meeting. Thank you, Chair.
Yes, Ms. Tleko is hospitalized and we wish her a speedy recovery. So the way she loves her work, I know she's joining from the hospital bed. and welcome, find our well wishes from the committee, Honorable Theko. We hope you will be back in circulation soon. Also, Honorable Kumalo has got a bereavement. She has lost her sister-in-law, and then we'll keep the family in our thoughts and prayers during this difficult time. So we'll convey our condolences to Honorable Kumalo and the family. So these are the apologies, the other apologies that I want to emphasize, that they've got issues, circumstances around them that makes them not to come to the meeting. Having said that, I think I need to welcome the delegation of the Interim Traditional Health Practitioners Council of South Africa. For us, it is an important opportunity to reflect on your mandate, the progress that you might have made since your appointment, the strategic priorities and the challenges you are facing in regulating traditional healthcare practitioners. I want to emphasize that traditional healthcare remains an integral part of the healthcare landscape in South Africa, particularly in rural and underserved communities, where many people continue to rely on indigenous knowledge systems and cultural healing practices. Traditional health practitioners play a significant role in promoting well-being, strengthening community resilience, and improving access to healthcare services. In this regard, colleagues, ourselves as the committee, we recognize the importance of building a credible, effective, and accountable regulatory framework that safeguards the public, that the framework that promotes ethical conduct and strengthens professional standards within the traditional health sector. As a committee, we also note that the Council derives its mandate from the Traditional Health Practitioners Act of 2007 and related legislative frameworks intended to formalize and professionalize traditional health practice in South Africa. At the same time, as the committee, we remain mindful of the persistent challenges continuing to confront the Council, including delays in the promulgation of the regulations. I should think Dr. Pillay is here, he will have to talk to it, and then including institutional and human resource capacity constraints, and then operational funding pressures, as well as concerns relating to compliance, enforcement, and governance within the sector. The committee is particularly interested in understanding how yourselves as the Council, you are intending to balance the preservation and recognition of indigenous healthcare system with the need to ensure accountability, standardization, public safety, and effective professional regulation. We are also keen to receive an update on the status of practitioner registration, the implementation of digital systems, and the Council's long-term strategy for establishing a fully functional, sustainable, and responsive regulatory institution. As Parliament, we have a responsibility to ensure that regulatory bodies are adequately capacitated and supported to fulfill their mandates effectively and in the public interest. We therefore look forward to a constructive, transparent, and solutions-oriented engagement with your good selves today. Having said that, can I therefore ask the chairperson of the Council to greet and also introduce the members that they have come along with? Over to you, Chairperson.
Good morning, Madam Chair. Honorable Chair, I'm trying to open my camera so that you are also able to see me. Okay, it's not allowing me. Please allow Zoom to access. Okay. I don't know, it's saying unable to access my camera.
You'll continue to try it, but let's not waste time as when we will try to open it as we progress. We'll be able to see you.
Thank you, Honorable Chair, and good morning to all honorables on the call, honorable from the committee, and good morning again once more, Thokozani, to all Gogo Nomkhulu on the call. My name is Sheila Gambele, and I'm the chairperson of the Interim Traditional Health Practitioners Council, and we are greatly appreciating that you've called us in this platform. It is our first time. Bear with us. We don't know what's going to happen, but we are not in panic, but we are so excited to join you and to learn from you, and maybe to be assisted from you from what we have already alluded on the challenges that we are facing. You've said a mouthful, but thank you so much. I think this sitting today will be an answer or a solution to some of the challenges that we are facing, but we are greatly happy or excited to be in this space with you. Thank you so much. May I introduce members of the committee? I would like to introduce Mkulu, the VC.
Mkulu. Chairperson, if they do that, if they're able to switch on the camera, if possible, for a few minutes. You can't still switch your camera because I got a message to allow you to switch it on. Still not working?
No, it still have, it says, please allow Zoom Workplace to access your camera from device setting. Maybe I'll have to go to my settings.
The settings, yes. So for those that you will be introducing, if they can they also put on their cameras so that we can be able to see them? We are public reps. When we meet them in the street, we must be able to greet them.
Thank you so much, Madam Chair. Bomkhulu Nabokoko, you, as the chair is asking that we open our cameras, please can we kindly do so? Chair, I hope they will be opening their cameras as well. Can I be guided that you can see the cameras being open? I don't. Okay, I see.
The best thing is will be for you to mention one person, then they will put on their cameras, we'll see them, so that you attach the name to the person who's speaking.
Thank you. Can I introduce VC Mkhulu Mkhweng? Kenneth Mkhweng? I'm not sure whether he's VC. Good morning.
I'm there, Chairperson, but my camera is not. Morning, Chairperson. I can't access my camera, but it's on. I don't know what's happening.
Okay, next time you'll practice before the meeting. Can we get the next speaker, please? Welcome.
Thank you so much, Chair. Can I introduce Dr. Mpho-Malachi?
Good morning, Chair, and greetings to all the honorables. Dr. Mpho-Malachi. I'm a member of the Interim Traditional Health Practitioner Council of South Africa. I represent the community. I come from the rural Limpopo in Palabora. I'm mostly representing Mahoshi Bamushate. Kagai.
You must teach your fellow colleagues who can use cameras. getting bad. On a lighter note. Next
Thank you,
one.
Chair. Can I call Penny, Mkhulu Penny Collins? Mkhulu Penny Collins? Penny, are you able to come? Maybe I'll come back to you. Can I call Dr. Kapule?
Good morning, members and the two chairpersons. Indeed, I'm Dr. Antile Hapule. My previous life, I used to also come and attend some such meetings in Parliament when I was still in Popo. I'm representing the communities. Thank you.
Thank you so much, Dr. Kapule. Can I call Koko Saramota?
Good morning, Sanbonan Dumelai. My name is Gogo Sara Umnyama Mota. I'm based in Pumalanga Province, Steinsdorp, Albert Lutuli Municipality.
Thank you so much, Gogo. Can I call Mkhulu Mongezi Ndanga?
Good morning, Good morning, Chairperson, honorable members of Parliament and colleagues. My name is Mongezi Ndanga. I'm a member of the Interim Traditional Health Practitioners Council. Thank you.
Thank you, Mkhulu. Can I call Nkosi Lukholo? Nkosi Lukholo?
Good morning, Chairperson. Good morning, all.
Thank you so much. Can I call Gogo Letisi Skosana? Gogo Leti? Gogo Leti? Can I move? I'm not sure whether Gogo Leti is on the call. Gogo Sarapula? Gogo Sarapula? Can I call Mkhulu Sibusiso Kumete? Mkhulu Sibusiso Kumete? Can I call Gogo Nomasundu Galloway? Gogo Nomasundu?
Good morning, Chair. My name is Nomasundu Galloway. I'm from Utnake, Eastern Cape. I'm the member of Interim Traditional Health Practitioners Council. Thank you.
Thank you, Gogo. Thank you, Gogo. Can I call Mkhulu Ramabulana? Mkhulu Ramabulana?
You can move.
Or can I call
move.
Kenneth Nochiombo? Nochiombo? Mkhulu Chauke? Mkhulu Malike? The acting registrar, Bruce Mbezi? Mkhulu Mbezi? Can I call Josephine Nengwanani?
Hello. Morning, everyone. My name is Josephine from National Department of Health. Thank you.
Thank you so much, Chair. These are all members that I've called that, yes, that they've accompanied us, or all of us, we are here attending to this meeting today. Thank you, Chair.
Thank you so much for the introduction. There's someone on the screen. Can the person or Umkhulu Chauke? Absheni.
I'm Shaweta Nkweni Kangwena ke. Thank you, Madam Chair and honorable members. Bukoko Namkulu, this is Rapulu Chauke. I'm also a member of Interim Traditional Council.
And there's somebody with the name of Benny indicating that there's network challenge in the Northern Cape, but we can acknowledge you that you are here. I think your name was called earlier, and welcome.
Yes.
Yes, I think you've finally introduced all your members, and as I indicated, you might have heard me mentioning the names of honorable members. As and when post your presentation, you'll again be able to know them, as they will be asking you questions that relates to your presentation. Without waste of much time, can I hand over to you so that you then proceed with your presentation? I wonder who's doing that.
Thank you so much, Chair, for the opportunity that you are giving us to present to you what the council is. Mkhulu Bruce, Mbetsi? Over to you, Mkhulu. Thank you so much.
Ndadembezi, you're on mute. Ndadembezi, you're on mute.
Okay. Good morning, Honorable Chair, and greetings to all honorable members of the Portfolio Committee on Health. And I'll also like to take this opportunity to greet all officials of the department led by Dr. Pillay. My name is Fatwani Bruce Mbezi. I'm the acting registrar of the Interim Traditional Health Practitioners Council, and I am requested to make this colorful presentation to the Portfolio Committee. And those who missed the opportunity to can see the picture of the chairperson. The chairperson is on the first slide of the presentation. We are led by Gonondo Sheila Kamambele, who has been introducing us as members. So the presentation that I'm going to present, I think, will cover all the issues that were requested in the invitation letter. And on the screen, there is our overview. The slide will be covering all those issues that are reflected there. I'm not going to waste time to read each one, because we're still going to come across them when we deal with each slide. So, as we all know, that the Traditional Health Practitioners Council, as introduced by the Honorable Chairperson, has been established in terms of the Traditional Health Practitioners Act number 22 of 2007. So it is founded in the following legislations, which is the first one, which is the Constitution of the Republic of South Africa, the National Health Act, and also the Traditional Health Practitioners Act, the Customary Initiations Act, which is administered by the Department of Traditional Affairs, and also the Indigenous Knowledge Systems administered by the Department of Science, Technology and Innovation. And the most important one will be the Public Finance Management Act.
Ndadembezi, you are not in the presentation mode. I think you can press F5.
I like what I'm hearing.
Am I still not in the presentation mode?
No, you're not. I think if we can get it in the presentation mode. If you're using two screens, you might need to swap.
Okay. And then now?
Thank you. You are. Thank you, sir.
Okay. So the current status of the Interim Traditional Health Practitioners Council is as follows. The Interim Traditional Health Practitioners Council was established on the 1st of May 2014. That was the first Interim Traditional Health Practitioners Council, which was launched by the former Deputy Minister Gwen Ramokgopa. And then the current council, which is currently presenting to the portfolio committee, was appointed in April 2023 for a 3-year term, which has ended in March 2026. Fortunately, the term of the council has been extended by 24 months, in line with the provisions of Section 4.3 of the Traditional Health Practitioners Act, and then the term has been extended to end in March 2028. All sections of the Traditional Health Practitioners Act currently has been proclaimed, and then Council is currently operating and supported by the Department of Health in line with the Memorandum of Understanding which has been entered into in March 2028. So the Memorandum of Understanding provides for the assistance of the Council on issues related to legal services, HR services, financial administration, and all other processes that can assist the council to operate independently and move out of the department. So the mandate of the council in terms of the legislation, the primary one is to protect the public and consumers of traditional health practitioners, of traditional medicines. And also we are mandated to register all traditional health practitioners in the Republic, because in line with the legislation, all practicing traditional health practitioners in South Africa are required to register with the council, and also to regulate and provide standardizations for the practice. We are also mandated to recommend training, ethics, and also the professionalization of the sector. We also have to provide oversight on the practitioners who are registered with us, and also conduct compliance with the regulations that would have been actually provided for by the regulator, and also maybe by the legislations. The most important one, again, is also on the issue of preservation of indigenous healthcare systems. So the law or the legislation is an instrument that can be used to preserve traditional medicine, which is our culture, and then which is also our inheritance. So the Traditional Health Practitioners Council, actually the Traditional Health Practitioners Act provides for 4 categories of traditional health practitioners. The first ones are the diviners. The second one will be the herbalists, and also the traditional birth attendants. The fourth one will be the traditional surgeons. So all these categories are the ones that are provided for by the Traditional Health Practitioners Act, And then the council is required to open registers on these 4 categories. The council is constituted as follows. As the chairperson was introducing them, the slide here clarifies how each of the member was actually appointed. Section 7 of the Traditional Health Practitioners Act provides for the constitution of the members of the council. Section 7A provides for the appointment of the chairperson. The chairperson is appointed by minister. And 7B provides for the vice chairperson. The vice chairperson is appointed by all members of the council. Actually, in their first meeting after appointment, they have to sit down and actually amongst themselves appoint the vice chairperson. So the vice chairperson, Mr. Kenneth Mukwing, was appointed as vice chairperson following that item in the legislation. Section 7C provides for 9 traditional health practitioners, each representing a province in South Africa. So you can see that 7C, we've got 9 members. From the Eastern Cape, we've got Ms. Nomasundu Galloway. From the Free State, currently we've got a vacant because a member who was appointed as a representative from the Free State has passed on. And then currently the department is facilitating the replacement of the member. The Gauteng province is represented by Gogo Letis Kosana, and KZN is represented by Mr. Sibusiso Gumede. Limpopo is represented by Mr. George Ramabulana. Mpumalanga is represented by Ms. Sarapula. Northern Cape is represented by Mr. Benny Collins. And the Northwest is represented by Kenneth Mukwing. You can see that Kenneth Mukwing is appearing for the second time, but this is following the directives that supposed to appoint the vice chairperson. So he was appointed in the first council meeting to be the vice chairperson, coming from Northwest. So from the Western Cape, we've got Nkosi Lukholo Mukhwejana. And then Section 7D requires a representative from the Department of Health. We've got Mr. Rampilani Murewani, who is representing the Department of Health in the council. Section 7E requires that we have one person who has got a knowledge of law. We've got Mr. Mongezi Ntanga. He's appointed in terms of that section. From the Health Professions Council of South Africa and from the Pharmacy Council of South Africa, currently we've got vacancies. These vacancies follows the ending of the term of the delegating council. So the department is currently facilitating appointment of the two representatives from the Pharmacy Council and also from the Health Professions Council. Section 7H, we've got community representatives. There are 3 of them in the council. The first one is Dr. Nsile Khapula. He mentioned that when he was introducing himself. Fortunate enough, we've got 3 doctors here. The Dr. Kenneth Netiombo, who was employed with the University of Mpumalanga and is currently on retirement. And we also have got Dr. Malachi, who also introduced himself as such. The 3 categories that I've mentioned earlier as the ones that are provided for by the legislation also has got representatives in the council. So the diviners are represented by Mr. Joel Chauke. Herbalists are represented by Mesa Ramota. And the traditional birth attendants are represented by Me Patricia Ngidi, and then the traditional surgeons are represented by Mr. Maleke Machimwani. So the Executive Committee of Council is provided for by Section 13 of the Act, and then is constituted as follows. It is chaired by the chairperson, Me Konondo Shilambele Kakama. The vice chairperson, as I've indicated, is Mr. Kenneth Mokweng, is also a vice chairperson of the Executive Committee. So Section 7E representative, Mr. Ntanga from the legal sector. Section 7C are 3 sitting in the executive committee, which is Mrs. Nomasundu Kalowe, Mr. Lukholom Khwechane, and Mr. George Ramabulana. Section 7G, as I've indicated, we still have a vacancy. Section 7G should be occupied by a person representing the Pharmacy Council. Section 7D is the person who is representing the Department of Health, and then that is Mr. Rampilani Morewa. So Council currently, because we are currently in the initial phases of the establishment of the Council, we have actually constituted the following committees. We've got the Executive Committee, as I mentioned, which is provided by the legislation. We also have constituted a legal committee, which is chaired by Mr. Ntanga from the legal sector. We also have the Human Resource Committee, which is chaired by Dr. Nzile Khapule. We also established the Registration, Education and Accreditation Committee, which is chaired by Mrs. Nomasondo Galloway. The Finance Committee is chaired by Dr. Mpomalaji. The Information, Communication and Technology Committee is also chaired by Dr. Mpomalaji. The Disciplinary Committee obviously is chaired by Mr. Ntanga, who is also chairing the Legal Committee. And then Council agreed that the spokesperson of the Council should be the chairperson, and the chairperson represent Council in all media briefings or in all issues that needed to be actually ventilated out to the public or to other stakeholders. Progress and achievement so far. As I have indicated, that we are in the initial stages of establishment, and we have not yet started with the real issue of regulations, but we have currently managed to process 24 internal governance policies, which were processed through the committees that I have indicated earlier. So we are currently expecting to actually develop further policies and process them through those committees and let them be adopted by Council. So currently the 24 internal policies I'm talking about has already been adopted by Council. We have also developed the Code of Ethics and the scope of practice for traditional health practitioners in all those 4 categories. The scope of practice actually has also been submitted to the department for publication or publication for public comments before actually it is actually promulgated as a regulation. The Registrar's Office has been established. I am currently appointed by Minister as the acting registrar following the lapse of the contract which was entered into with the previous registrar, and then processes are currently ongoing to try to appoint a permanent registrar. I myself, I am the director responsible for traditional medicine within the Department of Health, but currently a minister requested me to assist as acting registrar until a permanent registrar is appointed. So one other thing that has been achieved is that we are currently in the process of acquiring systems that can assist council to be functional or also to deliver on its mandate. We acquiring a database systems, a recruitment and payroll systems, and also the financial systems, HR and financial systems. So these systems, we are acquiring them through the departmental procurement processes. So the department went out on tender. They invited tenders for this for the provision of these systems. And then currently the process is at the near end, because I've been informed that it has already passed the evaluation process of these two tenders, the tender for the payroll and the recruitment, and the one for the systems. So the tender for the payroll, for the recruitment and payroll, will assist council actually to currently have the capacity to can recruit its own staff. The service provider will host will do the recruitment of all the staffs in terms of the positions that has been approved by council, and also to host the payroll, because as we are currently under the department, we won't be able to appoint staff and put them under the PESAL system. So council should be having its own capacity, maybe to host its payroll and also recruitment processes. But the tender that we have issued for the systems, that is the one that should sustain the operations of the council going forward. We have also actually managed to procure a tools of trade for the staff that we are anticipating to appoint shortly, using that procurement, that recruitment tender I was talking about. So the issue of the tools of trade, I think the department has managed so far to can acquire all the necessary tools for the prioritized post that we need to have as soon as possible. So we have also actually went on the roadshow and public consultation processes, which we have conducted nationally. And council has gone out on a roadshow. We went to all the provinces consulting our stakeholders. We also engage with our stakeholders. We had a meeting with the CRL Commission, and then we currently had, I think last week, we had a benchmarking exercise that we did with the Pharmacy Council. We visited the Pharmacy Council and we have established a relationship with them. We did a very successful benchmarking exercise that will assist us going forward. We also participate in the structures that are established in terms of the Customary Initiations Act. On the 4 categories that I've indicated earlier, we also have the traditional surgeons. So the traditional surgeons are the most important role players in the initiations, in the customary initiations, but they are regulated by this council, and they are supposed to register with this council. So the Customary Initiations Act is crafted in such a way that it also synergizes its work together with the Traditional Health Practitioners Council. So the National Initiation Oversight Committee established in the Customary Initiations Act also requires a member of this council to sit in the National Initiation Oversight Committee, and this council has actually delegated Mr. Maleke Machingwani to sit in NEOC structure. And also the Customary Initiations Act provides for the Provincial Initiation Coordinating Committees. So this committee, which is called the PICC, requires that all members in this act appointed in terms of Section 7C, as I've indicated, that they all comes from provinces. They should also be participating in the Provincial Initiations Committee. So which means if you are Gogo Letis Kosana appointed as a member of this council from Gauteng, automatically you are a member of the Provincial Initiations Coordinating Committee of the Gauteng as appointed in terms of the Customary Initiations Act. So that is how the two legislation talks to each other. So we are actually participating in those structures. So the department actually has published the regulations that details how registrations with this council should be done. I think the regulations are in terms of Section 41 of the Traditional Health Practitioners Act. The regulations were consulted with us as the council, and then we made our inputs and recommendations. And the regulations were published for public comment. We, as council, also partnered with the department in the consultations that were done for these regulations that were gazetted on the 21st of June. We also included consultation on these regulations when we were doing our roadshow in all the provinces. We also managed to actually invite stakeholders such as traditional health practitioners associations and organizations, and consult them on the issue of this, on the issues contained in these regulations. As I've also indicated that we have actually finalized our scope of practice for the 4 categories, and it has also been submitted to the department for gazetting for public comments, so that after consolidation of the comments from the public, then we promulgate the regulations on the scope of practice. So the issue of public participation in consultations, some of them, I think I've talked on them. The traditional health practitioners regulations we have done on that and in all the provinces. That roadshows was conducted between the 7th and the 22nd of August 2024. We managed to go to all the provinces between those dates because we wanted to consult before the closing date of the public comment, so that when the public is having an opportunity to comment, they must comment from a position of understanding what is contained in the gazette that has been published. So we went to all the provinces within those dates, and those dates were within the closing date of the gazette. The regulations that we were talking about before we went for consultation, we tried to translate the regulations into different languages, knowing our stakeholders. So in each and every province when we were consulting, we also consulted them in the language that they understand, and also we provided them with the copies that are translated into their language. So our strategic priorities is reflected in our operational plans. We intend to actually establish the office of the registrar, of which currently we've got the acting registrar appointed, but our ambition is to have a permanent registrar. And then engagements are currently going on with the department so that we can achieve this priority of appointing a permanent registrar. It should not be a difficult task, because we previously had a permanent registrar who was appointed, and it's unfortunate that his contract lapsed. But we are actually facilitating that a permanent registrar is appointed. We have actually designed a structure which has got a staff complement of 61 posts. And this 61 posts that we have managed to actually identify has already been graded and then by an independent service provider. They've also been costed. We are in talks with the department in terms of funding these positions. But currently we have prioritized 14 posts that we think if we can get these 14 posts, then we can have council start doing some of its work in terms of registration and all these things. We are also looking forward for the regulations that I was talking about earlier to be promulgated. We also intend to implement digital registration systems. Hence, I was talking about the systems that we requested the department to procure for us. We are patiently actually waiting for the process in terms of the procurement process of the department to unveil. But at the end, we will be having our systems that we have recommended that they should be procured so that they can assist us in on the issue of registration of traditional health practitioners and other institutions that are supposed to be registered with the council. In our operation plan, we are also intending to strengthen our stakeholder engagement and awareness, and we are currently developing our stakeholder engagement strategy that will inform us on actually how should we do about engagement with our stakeholders, and also it will identify important stakeholders and also put in place timeframes. When are we supposed to do this with our stakeholders? Because we have realized that outside there, our stakeholders are becoming more impatient with us not actually communicating constantly with them. Yes, the systems that I also talk about will enable the practitioners' registration and also monitor compliance with the regulations. So we will be actually be glad if all these things that we are anticipating can be achieved as soon as possible. But they are a priority in our operational plans that we also wishing that we can achieve them in time. So in terms of the budget, the table on top reflects how the council was actually funded since its appointment. In 2024, when this council is appointed, it was funded by about 2.8 million, which was very much an under funding. Due to some of the activities that we had to request additional allocation. You can see that during the year 2024-2025, on top of the 2.8 million that was allocated for council, we were also be provided with 13.5 million in order for us to can cover all those activities that I was talking about, including the road shows and also the consultations. This also include meetings for council and other maybe special meetings called by the chairperson. So in the year 2025-2026, our budget was increased from 2.8 to 9.0, and then the following year, which is the current financial year, it has also been funded. It will also be increased to 9.6 million. But the understanding that we are having with the department is that should additional funding required, then the department will also top up on the additional funding that we required. For example, we have got 2 tenders that are out that I've indicated that they've already passed the evaluation stage. Should those tenders actually exceed the 9.6 million that we have, we are of the opinion in terms of what the department has indicated to us that the department will cover the additional cost so that we have those systems as they are a priority and imperative for the council to can operate going forward. So that is the position in terms of the budget. We are operating within the prescripts and the directives of the department. We don't have our own systems. So the table that is indicated below, these are the estimate amount that we can actually raise as our revenue. If we can, by next week or by next month, we can find ourselves in a position to can start registering our traditional health practitioners council. So if you look on the numbers indicated in red, those are the numbers those are the amounts that contained in the regulations that we are anticipating that they will be promulgated soon as fees for registration. So fees for registration for ordinary traditional health practitioners, although when we were doing our consultations, we were anticipating that, or we were suggesting that a traditional health practitioner should register with an amount of 1,000 rand. During our discussions with the presidency when we were doing our CS certificate application, we agreed or we considered that the 1,000 rand could be too much, and then we reduced the amount to 500 rand. So on promulgation, when we promulgate those regulations, fees for registrations will be as indicated in red. traditional health practitioners will register with 500 rand. So council estimates that has got an estimated number of traditional health practitioners in South Africa. Traditional health practitioners in South Africa are estimated as being at around 300,000. So 300,000 traditional health practitioners, targeting 20% of 300,000, we will be actually coming down to 60,000 traditional health practitioners. So if we target registering 20%, which is 60,000, the total number that we can raise in the initial year for registration could be 30 million rand for registrations. And then we are also mandated by the legislation to register the trainees, Matwasana in our language. And then we are anticipating that, we are estimating that per year maybe we could be having 10,000 of those trainees. And then if we target 20%, which is 2,000, they are supposed to register with council with an amount of 100 rand. Then we can raise 200,000 rand. So THP schools, actually we are talking about these institutions that trains these trainees. Abogowela. So Abogowela will also be required to register with this council in terms of the legislation. So we are estimating that in South Africa we've got around 80,000 govelas, and then we will be targeting at least 20%, which is 16,000. Their registration fees in terms of the fees in the regulations, they're supposed to register with 3,000 rand registration fee. Then we can raise about 48 million in terms of registration the govelas. And then post-registration, there should be annual fees, which are renewal fees. So renewals for traditional health practitioners will be 250, which is half of the registration, and for the trainees it's 50, and for the training school is 1,500. So you can see that annually we can actually still raise about 39 million through registration, only for 20% that we have targeted. So this is how we are estimating and maybe anticipating the amount that we can raise as our revenue after we have moved out of the department, and we can also maybe raise funds for ourselves. Operational challenges that we are having currently. The first one should be the delay in the reappointment of the permanent registrar. As I was indicating, it has been more than 2 years now, or close to two years, that the previous registrar's contract has lapsed, and then this engagement with the department is currently still going on, and then we have identified this delay as one of our challenge, because the acting registrar has got his own functions to attend to, other than actually assisting as the acting registrar of the council. The delay in finalization of the CS process, we have actually finalized our engagement for the regulations with the department almost 2 years ago, or almost a year and a half ago. But what we are receiving from the department in terms of finalizing the regulations is that the department is still engaging with presidency in terms of acquiring the SEA certificate for promulgation purposes. So it has been a very long process that is delaying, and then one of the challenge that we have experienced was that presidency was also indicating that they are not satisfied with the manner that we have conducted the consultations, or we didn't do enough consultations. But I understand from the department side that in their engagement with the presidency, they have proven to them that actually the consultations that they have done were actually more than enough as prescribed by legislation. So now presidency considered or agrees that the council together with the department has done enough consultations. But the problem still stands that the CS certificate has not yet been issued. We don't know when is this certificate going to be issued so that it can allow the department to continue with the promulgations of those regulations. One other challenge is the prolonged departmental procurement process. As I have indicated, that we have two tenders that are out. If it was not for this procurement process, the prolonged procurement process, we should have these services actually long been delivered to council, and council should have been actually currently far with the issue of preparation for registration for traditional health practitioners. So we can't start the issue of registration without those systems and without the staff that need to be appointed and operate within the office of the registrar. So those are some of our challenge. The biggest challenge that we have currently is with the CRL Commission. The CRL Commission is established in terms of the legislation, just like us as council, established through the Traditional Health Practitioners Council. But what is happening outside there is that although we had an engagement with the CRL Commission, what we agreed upon and what we also wanted to do going forward, we wanted to enter into a memorandum of agreement or a memorandum of understanding so that we can work together going forward. But we have suddenly realized that the commission is out there having consultation with traditional health practitioners, and then traditional health practitioners are being actually, they're saying they are looking for a mandate from the Traditional Health Practitioners to repeal the Traditional Health Practitioners Act number 22 of 2007, of which this is some of the things, this is one thing that we are unable to understand, because in a letter that they wrote to us indicating that they want to consult with the traditional health practitioners on the regulations. And then we advised them that it is not proper for doing consultations whilst we are still waiting for a legislative process of promulgating the process, the regulations finalized. Because in terms of what we have done, we have done consultations, and then we were waiting for the CS certificate so that these regulations could be promulgated. Now, CRL Commission wanted to go and have other consultations on the regulations, of which we didn't understand for what purpose, or the purpose that those consultations will serve in the process that we are undertaking. So after we advise them that it is proper for them currently to actually consult the department, because the regulations does not belong to the council, they belong to the department. They should consult the department on whatever complaints they have on the regulations and sort their problem with the department. What they did is the opposite. They are now consulting in provinces, and they need a mandate to actually start the process of repealing the Traditional Health Practitioners Act number 22 of 2007. And then Council agreed that we should bring this to the attention of Parliament, because together with the CRL Commission, we are products of legislations developed or approved by the Parliament. So we are actually here to actually bring this to your attention, honorable members. So the last maybe slide that I'm presenting here is with regard to the legislative imperatives. What actually is happening currently when we are not actually fully operational? So the first challenge that we have is that Section 49 of the Act establishes offences, and then we have not yet started with the registration of the traditional health practitioners. So one of the offense that we are having is that it is currently an offense to actually practice as traditional health practitioner in South Africa without registering with the council. So it brings forward a challenge that we do have a lot of traditional health practitioners operating or practicing outside there, but we have not yet started with the issue of registering traditional health practitioners. So the Customer Initiations Act also defines traditional surgeons as as a person who is registered with the Traditional Health Practitioners Act as such. So that is also one of the challenge. The Indigenous Knowledge Systems Act also, it says that no indigenous knowledge practitioner may practice for gain unless the practitioner is registered with the relevant government department and been granted permission to practice in terms of the applicable prescribed practice standard. So which means people who are supposed to be registered in terms of that act should, before registered as indigenous knowledge holders, they should be registered with the council as traditional health practitioners in terms of our act. So the last one, which is causing a lot of commotion outside between the department, the council, and also the employers, is on the issue of the provision of the sick notes. Employers are receiving a lot of sick notes that are issued by traditional health practitioners. And then now, in terms of the Basic Conditions of Employment Act, a legal sick note should be issued by a practitioner who is registered with its regulator. So that means traditional health practitioners, before issuing their sick notes, should be registered with the council for their sick notes to be compliant with the Basic Conditions of Employment Act. So we are experiencing problem where employers, when they actually contact us in terms of verification with a certain practitioner, and then we indicate to them that we are not actually fully operational, and then we have not yet started with the issue of registration. So those sick notes issued by traditional health practitioners becomes a problem. The employees are actually one way or the other being subjected to disciplinary processes, or they are fired. So these are some of the things that are actually happening outside there. And then on the other side, we need to facilitate the operational of this council so that we curb all these things that are happening in terms of other legislations. We have been partnering with other institutions. I've indicated that last week we had a benchmarking exercise with the Pharmacy Council. We have engagement with the CRL commissions, although our relationship is turning sour. Collaboration with the Department of Health and their provincial coordinators. Parallel to this legislation, honorable members, I think should also take into consideration that the department is also driving a policy that is intended to include a traditional health practice within the national health system. So the mandate of the council is to regulate, and then the department is also developing policies for the inclusion of a traditional health practice in the national health system. So with our provinces, we have established structures in the provinces that assist us when we do consultations on policy issues or when we implement some of the programs or activities that we need to implement in the provinces as the department. So now council also is in collaboration with the Directorate Traditional Medicine, including their provincial structures, so that it can be assisted in trying to have inroads maybe to traditional health practitioners in the provinces. I've indicated the relationship between this council and the NEOC and PICC in terms of the Customary Initiations Act. And also, lastly, we are participating in the activities of the BRICS. We are aware that this year India is hosting BRICS, and our chairperson is participating in meetings that are currently happening and other engagement on traditional medicines related to the BRICS 2026 in India. We're also participating in the WHO activities. Honorable members will also maybe remember that traditional medicine is also high on the agenda of WHO and also BRICS. So we are also actually included. Actually, the department also made sure that we participate on discussions related to the WHO activities and also the BRICS activities. So in conclusion, is just to mention that traditional health care remains a critical pillar of healthcare. I think the chairperson, honorable chairperson of the committee, I think emphasized this in her opening speech. And also, council is central to professionalization, accountability, and public protection. Council has also made foundational progress despite resource constraints, and also we also seek support from Parliament in this regard. Thank you very much, Honorable Chair. I will stop here and hand over back to you, Honorable Chairperson.
Thank you so much, Registrar. Thank you so much for the presentation. It's welcome, and indeed you have responded to all the issues that we have raised. Then we can allow colleagues to interact with the presentation as presented, and also to welcome those members of the council that also joined late. Yeah, everyone wants to speak on these issues. Let me note the hands of the colleagues. Number one, it will be Honorable Mutuvatse. Honorable Leroux, Honorable Clark, Honorable Litlape, Honorable Shirampungose, in that order. 2, 4, 5. Yes. Those are the hands that I can recognize now. Honorable Mtuvatse, I didn't introduce you earlier. You joined the meeting a bit late. Welcome and good morning. The opportunity is yours.
No, thanks.
Maybe you can flight just a photo for the time being for the members of the council to see you. I know bandwidth is a challenge. Then you can then switch it off there.
Yeah, I'm en route, Chairperson. Here I'm alive.
Okay. Thank
I
you.
just but no, thanks, Chairperson.
Okay.
Yeah, no, thanks, Chairperson, for the opportunity, and good morning to everyone who is on the platform. And thanks for the council to finally come and appear in front of the portfolio committee. I hope members of the council understand the importance of the existence of this particular structure. More so that at the end, I think the member indicated that they are interacting with BRICS countries, and BRICS will be held in India. And India, as we speak now, and China are far much ahead of us in dealing with these matters. And it pains me, Chairperson, I must say that we are lagging behind as Africans. We have allowed the Western system to subordinate our culture. And I can say without any fear of contradiction, maybe I should start by asking this question. Why must the interim council, as it is now, the extension by the minister, I think a few days ago, why must it not be challenged? Why must they continue to exist as an interim structure after so many years? I'll try and because the presentation emphasized on government structures, on policies, on consultation. But there's no evidence that provide the actual preservation of institutional and digital knowledge systems. Nothing. In fact, yesterday, as I was going through this program, I can simply say this council becomes what I call the Cinderella council, the Barbie doll council, because their activities are only centralized on. There's no actual impact that has been done as per the mandate that has been given. Now, I do not actually want to, because I've made some serious observations. For example, I mean, the budget projections of 9.62 million in 2027 are modest compared to estimated 78 million potential revenue from registrations. You know, there are quite a number of things that I've made observation of, but let me just dig into my question. I just wanted to make that opening statement. Now, why has the council failed to demonstrate any measurable preservation of indigenous knowledge systems beyond consultations and codes of ethics? And where is the evidence of integration into national health insurance framework? 3, why is there no dedicated budget line for indigenous medicine research, institutionalization, or intellectual property protection? And how does the council justify spending millions on government structures while traditional healers remain excluded from workforce planning? What mechanism exists to ensure coherence between herbalists, birth attendants, and the surgeons beyond the categorization? So, Chairperson, I think I must stop here. I'm going to submit the full list of the questions because there are too many. The bigger question is, why must we continue to have an interim council? And I'm going to raise this question with the minister, because I don't see the reason why, after so many years, we must still have an interim council. These members of the council like it because it is a way that has been designed to siphon funds from government. That's basically what it means. I'm going to raise this issue with them. I'm raising this issue that, in fact, I'm calling for this the extension of this council to be rescinded by the minister, because there's no reason for them to continue to exist, Chairperson. They are actually a disappointment to our ancestors, they're a disappointment to our people, they're a disappointment to our culture, because what they are doing now is to continue to siphon funds for their own personal interest and not advocating for what we said must happen. Thank you, Chairperson.
Honorable Dr. Liru, over to you.
Morning, Chairperson, and morning to everybody on the platform. Thank you very much for that presentation. I'm going to just show, I've shown you my sign of life, but I'm going to put my video off for bandwidth reasons. I just wanted to get some clarity around the legislation and the different ways, the different forms of legislation, including the Traditional Health Practitioners Act and the Traditional Surgeons Act, how they and how they sort of interact and who they fall under. Do they fall under the Department of Health, or do they fall under the traditional healers bodies or traditional leaders bodies in each of the houses in each of the provinces? So I'd just like to get some clarity around that. I just also wanted to comment just from my side as a medical doctor who's worked in the rural Eastern Cape I worked there for 16 years, and unfortunately my experience of traditional healers was predominantly negative, because we had many patients who came in, particularly children who had been given traditional medicine, who were extremely unwell. We've also had children who came in, small children under the age of 6 months, who were born with birthmarks, and they had been cut with a blade. I had 2 children who had been cut with a blade more than 100 times on their back, and were basically in shock, and both died of severe infection as a result of that. And so we have a very important role, both from the Department of Health and through through this legislation, to protect the public from acts and from treatments that are harming the public. And so I think that it's very important that we recognize this, and that I would very, very much like to get an understanding about how we can ensure that practices that are followed are scientifically based, are done in a way that keeps the public safe and ensures that people are not harmed. And so I'm also concerned to see that if there are 300,000 traditional healers, how do we regulate that? How are we able to ensure that they practice in a way that is safe for the public? And so I think that's and how is the council going to do that? Because that's an enormous amount of people that have to be kind of monitored and kept an eye on. And we have the Health Profession Council has a tough enough time as it is with medical doctors. And so I think that is something I'd like to understand. I also would like to understand how, it seems the legislation has been saying since 2007 that people need to be registered with the Traditional Healers Council, but it's now nearly 20 years later, and that hasn't actually been enforced in any kind of way. And I don't quite know how that is going to happen when you've got 300,000 people out there who are unlikely to want to pay this, and who have been practicing without paying this fee. And I think for many of them, 500 Rand is a lot of money. So I don't understand, apart from the fact that in legislation it's said that it has to happen. Are we planning to start enforcing it? I see that you're estimating you might get 20% of people signing up and paying this fee, but if we are following the legislation and people are not allowed to do any work as a traditional healer for remuneration without being registered, I mean, the practicality of this are enormous. And so I do want to understand, number one, how we think we're going to be able to enforce this. And also, I want to understand what the role of the council is going to be in terms of ensuring that the public remains safe from unscrupulous traditional healers who are giving unproven and dangerous treatments to patients. I also wanted to just talk about the Traditional Surgeons Act, and I think that there has been some progress in that. Again, in the Eastern Cape, there have been some significant improvements in some areas, but we still see young men being maimed and being killed or dying after traditional circumcisions in the Eastern Cape every single year, and we should not be losing these young men. And again, there are many practices that are part of that process that are, particularly the withholding of water, that are concerning, because that is obviously harmful and dangerous. And a whole lot of the young men who come into hospitals who are ill after a traditional surgery are dehydrated and are in renal failure. And so again, I'd like to understand how the council ensures that traditional surgeons are doing this in a safe manner, are not doing harmful practices like the practice of withholding water from young men through the process of healing. And finally, I'd like to understand, in terms of, I know that my colleague mentioned the issues around research, but what research is there available to? Have we got any research showing benefit of some of the medications, perhaps, or how do we kind of assure the public that there is a standardization around treatments and that these treatments are safe and effective? Thank you very much.
Thank you, Honorable Luru. Honorable Clark, in that order.
Thank you, Chairperson. I've just got 3 questions. I would like to know, why have they not submitted an APP or an annual report? Because that was not in the presentation. And if they could tell me, what is the delay in reappointing a permanent registrar and the finalization of the CIAS process? And then, when will regulations be promulgated, and what is the reason for that delay? Thank you.
Sweet and short. Honorable Dr. Letape, over to you.
Thank you, Chair. Proof of life will be provided at the end of the debate. And now that you've seen me, I will take it off for bandwidth. I have a few questions. The first is, in terms of the legislation, why do you have a 3-year term? Because it means you'll always be preparing for elections. Because a 3-year term disappears very quickly. Why is it not a 5-year term? I just want to know. Because otherwise you're spending more time having elections, and when people acclimatize to what they are supposed to do, it's time for them to leave. Some will leave even before acclimatization. The second question is, the acting registrar, given the mammoth task that the acting registrar has, why have you not been seconded to the interim council so that you are absolved of your other responsibilities? This would be a difficult job as a full-time job, but when you have 2 jobs, you are frankly being abused. Why are you not seconded? Or why was there not an extension of contract with the previous registrar? Now, I'm seriously concerned about what has been reported, that the presidency was worried about the adequacy of the consultation process, because that's where all this thing is going to fall. And once you're having challenges with the Commission for Cultural, Religious, and Linguistic Rights, we are in trouble. If you look at, I'm just challenged by the fact that you convince them that their fears are not correct. You've consulted properly. Now, if you look at Section 185C of the Constitution, when it speaks about functions of the Commission for the Promotion and Protection of the Rights of Cultural, Religious, and Linguistic Communities, C reads, to recommend the establishment or recognition in accordance with national legislation of a cultural or other council or councils for a community or communities in South Africa. I read this because it's a function in the Constitution. And clearly, it seems like there was never any meaningful engagement with that commission. When in the Constitution, it may be argued that it is their job to recommend to Parliament the establishment of a council like this. What happened there? Who dropped the ball? Now, you have some of the practitioners that you want to regulate are traditional birth attendants. Maybe I missed it. The closest nexus to what we have in terms of regulation for births are midwives who are under the nursing council. If I remember correctly, there's a rep from the HPCSA, there's a rep from the Pharmacy Council, but I haven't heard of any representation from the Nursing Council, which would have a nexus to traditional birth attendants that the others would not have. Now, my other concern is that we're establishing a new council. We're tendering for registration systems. There are many councils under the leadership of the Department of Health, Health Professions Council, Pharmacy Council, Nursing Council. They register practitioners. The department is creating a framework under NHI to be able to do that. Why would you not negotiate with one of those councils as the Department of Health on behalf of the interim council for them to piggyback on somebody's existing registration platform, so that you don't go through the expense to do something that you can't afford and to reinvent the wheel? Negotiate with the Pharmacy Council, they use their template, they support you, and they create a group for you under their system, or Health Professions Council, or Nursing Council, or the department itself. Why are we tendering for a structure that has no funds of its own? And I would suggest, Chair, that it's going to be important to resolve this issue of consultation, the issue of the CRL, because we are not founded on sound ground. And when this thing gets challenged on consultation and other people's duties, etc., we're going to end up with a problem. Thank you, Chair.
Thank you, Honorable Litape. Honorable Shirampungose, over to you.
Hello, greetings once again to yourself and to the council and staff members and everybody who's in the meeting. I think, Slalo, it's a very crucial conversation we are having, and if you can allow us to, go into some of these matters that are being raised in the presentation and by other members, I hope that there will be another engagement that we have with the council as a committee. I'll give just a bit of a personal background just so that you understand the framing of my question. My grandfather was a medical doctor, Dr. Matlalane, Mamelodi. He was practicing in Mamelodi, but he was also a traditional healer. And kwakunesaying ukuthi like into ejwayelekile ekhaya ukuthi where Western medication or Western medicine falls short, then African solutions come and become the viable intervention. So that has always been like the background to which I was raised under, for example. I know many other Africans can relate to this particular perspective. My grandmother as well was a sister in a government hospital, but she was also practicing as a naturopath that was qualified as well. And it really is a concern when we have such a body that is supposed to serve such a big mammoth task in South Africa, but has not been operationalized, for more than a decade, as other members have stated. But more above this is that this slow pace actually reflects a much more deeper issue that we have in our medical or healthcare system. And that is colonial bias within the healthcare system, where Western medicine receives institutional support while African healthcare systems remain marginalized. Even in how we raise problems in relation to African medicines and African intervention, reflects this particular bias. There's many people every day who die in our hospitals who are given wrong medication, or given wrong diagnoses, and there will never be a conversation that delegitimizes the system of Western medication or Western healthcare. But when we have incidences on the African side, then it's almost as if the entire practice, the entire system, the entire African knowledge systems are being legitimized and criminalized. And even in our framing of our conversations with the council, I think we must be cognizant of that, that we don't, build on this particular bias that's rooted on colonial conquest and apartheid. We've established that, and on numerous occasions with the minister, that we require much more integrated efforts from the department in relation to not only regulating African medications, because there's a particular framing of words, where it's as if Uguti, just because it is not being regulated, then it is delegitimized. It's not the case. Many of our people live in a particular system, and they are doing. But to the council in particular, we find these budgetary contradictions to be quite concerning. With the small allocations that you get, million 2024 and 9 million in 2025-2026, and really, from just hearing these numbers, it then becomes clear that there's absolutely no way that the council can regulate over 300,000 practitioners with such a minimal budget. And I think this is one aspect that we should be raising with the department, that we should be raising to call in Treasury as well, to find out why the council has been undermined through this particular underfunding. And second to that, to the council, is that what infrastructure currently exists in rural provinces where traditional healthcare is most relied upon. And second to, when will you be fully independent from your perspective, with your own infrastructure, with your own provincial offices and staffing? You already have a big issue with the issue of the registrar, and I think others have deliberated on that. So I'll just on that. So as the EFF, we do support the increase of your funding for indigenous healthcare institutions. And we really do believe that traditional medicine should not depend primarily on practitioner fees for sustainability. And I think this we've raised across the board. We've called on, these boards that regulate and that have people under assigned to them to be able to be validated as practitioners, especially in the health fraternity. It's not sustainable. South Africa is not the country where an institution like this should survive on practitioner fees for sustainability. It's not feasible. The economy doesn't allow for that modus operandi. So I think you must relook at this thing, because we definitely do not support it. A person who's undergoing training must pay, just to be recognized for that process. It really is, it doesn't make sense, and it really does infringe upon the autonomy and the ways of being of African healthcare systems. I think even in our conversations of decolonization, some aspects we really must apply without fear or favor. That we are not trying to utilize the same templates of Western medication and Western healthcare systems and just apply it on the African side and then see that as progress. It's not decolonization, it's assimilation. And we must be cognizant of how that will actually thwart the practice, the industry, and the people on the ground. I know very little people who would be keen to this process. They'd even rather keep it away from you guys from finding out, and they will still continue. And I think other members have spoken about this as well. But what is it that will make somebody leave their home to come and register with you guys to tell you that I'm undergoing training? It's not a technical issue on most instances. It's very spiritual, and even our conceptualization and our understanding of it must not chip away at some of these tangents that make African healthcare what it is. And thirdly, in regards to bogus traditional healers and public safety, the council does identify as a body that should.
Honorable Shira?
Yes, Chairperson?
I was missing you, okay? Unless if
sorry
it was
about that.
on my side. Sure.
Yeah, it
Proceed.
must be myself. I'm in a compromised environment with network. I was asking about traditional healers, bogus public safety, offer public protection and ethics as part of their mandate. So, in relation to that, we want to find out.
Is it only me who can hear, colleagues?
We're losing her, Chair. Yeah, I also can't hear.
Am I audible now?
Yes, you are. So you will have to repeat what you say.
Oh, my word. All right. Ngibuza ngendaba yama-bogus traditional healers and public safety. To find out from the councillor how many bogus practitioners have been investigated by the council, or how many of their prosecution have been facilitated by the council, and also what mechanisms they use or exist to protect communities from scams that involve fake spiritual healers, harmful concoctions, and exploitation. Chairperson, I'm asking this because in as much as SAPRA has the jurisdiction of giving authorization for certain herbal medications and all of that, there's also a very strong delay on that part, on the part of SAPRA, right? And I think this is the gap that the council should be able to fill in, to be able to link traditional healers to the relevant stakeholders, and to also advocate for recognition of their ways of being and their medications and all of that, because SAPRA is doing a very bad job in relation to this. There's a particular case that we brought to their attention. There's a Chinese doctor, he's a medical doctor, Western medical doctor practitioner, but he also practices culturally as well or traditionally as well. So in a sense, during a diagnosis, yabona mawungena endumbeni akuwena okhuluma diagnosis, bakutshela diagnosis yakho. The Chinese practitioner does the same, but through palm reading. So there's many other aspects that we can touch on in relation to African medications, and not only that, but also indigenous healthcare systems. And I want to know how far they go in relation to that, and what disciplinary processes are at our disposal or that exist for practitioners that are involved in abuse, assault, or deaths during initiation practices for Amatwasana, and I think a member spoke about initiation schools as well. And then lastly, on transformation and research, we want to find out what partnerships currently exist with universities to scientifically research African medicinal plants. And we also want to find out from the perspective of the council why South Africa is still importing pharmaceuticals while indigenous medicinal knowledge remains so underdeveloped and uncharted grounds. Is there a national strategy to commercialize and protect African medicinal intellectual property? I'm asking this as well because a lot of traditional health practitioners have highlighted the dangers of interacting with government bodies. There's one that I interacted with, Umkulu Omdala Kakhulu, who's been practicing for many years across the continent, who said that he was engaging with the CSIR years ago, and he had to change, where he stays and pretend to be somebody he's not, because his life was in danger. And I know the council is aware of such stories as well, not just from this practitioner, but from various other ones who are like, no, we do offer, engagement and collaboration with the government, but then we get abused, or our health interventions get stolen, our IP gets taken away, and then they get repackaged and brought in back in South Africa as if they are new interventions. We really want to hear from the council, Uti, what then becomes your position in relation to that? How do we support a state-led industrialization and beneficiation of African medicinal knowledge, for example? And how do we ensure that it also becomes part of publicly owned pharmaceutical research sector without practitioners, without healers, without diviners being taken for granted, abused, exploited by those with the powers on the top, at the top there. And then lastly, sorry, I'll just have to write the other questions with the issue of the CRL commission. What exactly is the dispute between the council and the CRL commission? We were unable to just pick that up at a concise level. Is it a tough war over authority and regulation? And how is this conflict affecting practitioners and communities on the ground? And did the minister ever try to intervene on this issue? I think that will guide in knowing where to from here to be able to intervene on the issue that the council is raising. But lastly, Chairperson, the EFF supports the full recognition, the protection, and the development of African indigenous healthcare systems as part of dismantling colonial domination in the healthcare sector. However, recognition, engena funding, engena regulation, engena implementation, legislation without institutional capacity will continue failing poor communities that rely on traditional healthcare on a daily basis. The state must invest seriously in African medicine, in practitioner regulation, in research, in infrastructure development, and public safety as well, while being able to protect indigenous knowledge system from exploitation and commercial abuse. Thank you for the opportunity.
Thank you so much. Before I ask question for clarity as well, DDG Pile, who's the senior official responsible for this entity? I want to address that person in particular. Can I get that clarity first? DDG Pile?
Thank you, Chair. The council is the interim council and reports to the department as a professional council and falls under my branch. Yes.
Is it your branch? So you are the lead person. I'm raising this because there are things that the Act empowers the minister to do. And then you being the representative, I wanted to check who will take overall responsibility in the absence of the minister. So these are the issues that I wanted to raise. So it's you. You are the lead. It falls under your branch.
Yes.
Thank you for that. Let me start with this issue of the CRL Rights Commission. As Honorable Chirwa has raised it, and also Honorable Letlape, though he was raising the constitutional imperative. At the end of the day, I'll also raise it in line with my previous background. I used to be a chair of COGTA the other term. So the CRL Rights Commission used to report to us. But I should think we need to understand the nature of the dispute. Because the way it's put there to say it's a problem, they are mobilizing against compliance with the Traditional Health Practitioner Act. If indeed that is true, then I think that's why you need to package for us to tell us what is the actual problem, because they are also a creation of the statute. You are also the council is also a creation of statute, and then all these two acts, they are specific on whose role, who plays what role. So then, if you have a situation wherein, as you put it, that they are mobilizing against traditional healers complying with the act, then there's a serious problem, and it's a matter that needs our urgent attention, to an extent that I'll have to then convene the meeting for them with their also respective portfolio committee, so that we get this thing right, because it can't be right that they have such an overreach. So that's the issue that I want you to package. The nature is Honorable Shirois indicate the nature of the dispute, because you are all a creation of a statute. It being a chapter 9, it's even worse, the CLA Rights Commission, because it has got some constitutional obligation. But I know, and having gone through the act, they were also consulted when this act was enacted and promulgated into law. So I don't know what could be a problem now, unless then the other one wants just to do overreach over the other. So make sure that you give us detail the nature of the issue and the dispute in this case, because mobilizing is a very big work. A word to say they are mobilizing against the implementation of the act. We cannot have such a constitutional chapter 9 institution doing that. It's uncalled for. I hope you're gonna give us that. Then you spoke about the delays in the reappointment of a permanent registrar. Do you mean that initially, prior to your appointment, there was somebody who was appointed then in a permanent position? Maybe that term then expired to an extent that then you were given this responsibility. That clarity is very important for me to that effect. And then that's where now, Dr. Pillay, the issue of the minister come to the play, because the act is very clear. I'm trying to quickly check. Section 18 of the act is very clear what needs to happen when it comes to the issue of the appointment of the registrar as an accounting officer. It says that the minister, after consultation with the council, must appoint a registrar. And then it's the minister who may dismiss such a person. And then the appointment of the registrar is subject to the conclusion of a written performance agreement entered into by the minister and that person. So in this case, maybe and you are raising it now as an incumbent of the position, that there's a delay in the appointment of a registrar. So maybe council and yourself, Dr. Pillay, you must be able to come clean here to us and tell us what has been the problem in you complying with the act as is prescribed in terms of section 18 of the act. Then the issue of the CESA and the presidency with regard to consultation. I'm a bit worried, colleagues, also to say, since this council has been established in 2014, and then we are now in 2026. How many years down the line? Then we are just failing to just publish mere regulations. I mean, we, in all fairness, and I know it's not on the council side. That's the issue again. Yourself, Dr. Pillay, you need to tell us what has been happening all these years. Now we are only told about the CESA's process, whereas then regulations were supposed to have been in place now in operation. And I'm also then have an issue with regard to the people who are in the database of the council registration of, and then it's in line with the question that the other colleagues has raised with regard to the issue about the bogus traditional healers, and it's a majority of them that are all over the country. But then you had this empowering legislation in terms of Section 21 of the Act, which is very clear. In particular, 21.1, it says that no person may practice as a traditional health practitioner within the Republic unless he or she is registered in terms of this Act. And you know there are so many bogus. Maybe you need to tell us as a registrar to say how many traditional healers, health practitioners are registered in line with this section. And then also, I've seen a sequence of budgetary, your budget has been continuously increased on this matter. And then I will think to say, what programs have you embarked on to make sure that all the traditional healers in the traditional practitioners in the country are registered in terms of the Act? Because all over, like the other colleagues are saying, that we support your existence, we support the indigenous knowledge. Every village, every community has got a traditional health practitioner. But then what were the mechanism for you to mobilize these people that they get registered in terms of the Act so that you can have authority over them? So these are some of the issues that I don't see it coming clearly on your report. Then other issue that I wanted to raise, Section 23 of the Basic Condition Employment Act, it deals with the issue around medical certificates by traditional health practitioners. And then in my other life, while I was a CCMA commissioner, these are the matters that we're confronted with, because there will be bogus medical certificates coming from all the so-called traditional health practitioners who are not even registered, whereas Section 23 is very explicit to say medical certificates of the basic condition implemented. Medical certificates are valid only if issued by a practitioner certified, diagnosed, and registered with the professional council established by this traditional Health Practitioners Act. So I'm trying to raise this to say the mere fact that you don't have a register, even if it's there, it's not everybody who's there, because you see some bogus medical certificates that are coming, and then employers have rejected that in most of the cases. And then whereas the innocent people, they believe that when they visit the traditional practitioner, this person is compliant. So these are some of the issues that we want you to seriously talk to us on them, because they are matters of concern. So I can end up here, and we'll see as we progress, how do you respond to all our questions, and then we can make follow-ups time permitting, failing which then we can also submit the questions to be responded to in writing. So I will first allow the DG Pillay to respond to issues that relates to the ministry. It's very important that you respond to those issues before I hand over to the chairperson of the council and the other council members. Over to you, DDJ Pillay.
Thank you, Chair, and thank you for the questions. Let me start by just explaining the way we think about a traditional medicine practice, both on the African continent and more globally, and the way it's organized. So it's organized in three categories or parts. The first is the regulation and the management of the person, the individual who's the traditional health practitioner. The second is to manage the product that particular individual may provide to a patient or a client. And then the third is the practice. So how do you go about delivering your service in addition to the product itself? And this council is particularly vexed with the issue of regulating the person. So in other words, is the person appropriately skilled to be able to deliver the service, and what is it that the service entails. So that's what this council deals with. On the issue of the product that may be used, here we're talking about the various herbal products and the like that traditional health practitioners would dispense or deliver to their patients and clients. These have overlap with the what happens through SAPRA, as well as other entities such as the work that the Department of Science and Innovation is doing around indigenous knowledge systems, and there's legislation within DSI relating to that. So this council is not involved with the actual registration of products per se, but clearly there's an overlap between what the practitioner will do and what the council does. Chair, coming specifically to the question around the post of the registrar. So the post of the registrar, sorry, firstly, before I talk about that, let me say that this is an interim council, and the agreement with the National Treasury is that they would fund the council to the extent that the council is then able to collect fees and regulate itself, a bit like what happens with the HPCSA, nursing, pharmacy, etc. And so the funding, as the Treasury would describe it, is seed funding to get the work of the council going. Now, on the issue of the registrar particularly, the Treasury at the time had allocated a budget for the work of the council, including the salary of a registrar. And the budget is allocated to the National Department of Health. Since the council is the interim council, it doesn't have a separate bank account or any of those things, which means that the position of the registrar effectively becomes an employee of the National Department of Health, not of the council itself, because the person is, I think, as Honorable Letlape mentioned, is then seconded to work with the council, but has to be employed in terms of the public service. So the challenge that arose is that the DPSA has raised difficulties with allowing us to create the post of the registrar in our structure, given that it is a separate structure. So our colleagues in human resources have been trying to persuade DPSA that this is an interim arrangement until the council is obviously operational from a financial and independent perspective to be able to do that. But to date, as I understand it, they have not approved that we can go out and appoint a registrar on our establishment, given that it is for a separate council as such. So that's the issue around the registrar and where the delays are. Chair, on the issue about the CIAS, so when we pass regulations, one of the requirements is that we must do a CIAS analysis. Now, it appears that some of the parties that are involved in this sector were not happy with the regulations. And let me say a little bit about that. So it seems from our assessment that there are associations of traditional health practitioners. And these associations are operational in various provinces in the country. And traditional health practitioners become members of these associations and pay fees to the association. Now, in the absence of a formal council, as we are trying to establish here, these associations de facto became the representative organizations. When these regulations and the proposal was presented, many of the associations felt quite threatened by the approach, because what it would mean is that there would be little value in now becoming a member of an association simply because there's now a council. And associations may exist, but they would not advance the issues of the profession, since that is what the council would be dealing with. And so there are many objections relating to to the regulations that were presented. But those objections were largely based on the fact that the council should not establish a professional body, that the associations, the council should regulate through association. So in other words, if you're a traditional health practitioner, you become a member of the council of the association, and the association then simply shares that information with the council, which is quite irregular in terms of the way professional councils operate. Which would mean that there would be an intermediary, which is an association. So it was claimed that this Traditional Health Practitioners Council did not engage in public discussion on the regulations. However, we have, reams of evidence of the members of the council going to all the provinces, engaging with practitioners and explaining the process and how it would follow. So it seems that many of those practitioners then wrote to the presidency to say there was no engagement. And so in our discussions with the presidency, we laid bare the evidence of the engagement. And I think the presidency has now accepted, well, at least from our last meeting, that there was engagement, and there was meaningful engagement. There was a documented reference to all the inputs received from the various practitioners across the country, and where the council accepted it and where they didn't, and reasons why things were not accepted or accepted were documented as well. So I think on that score, on the issue of consultation, we have largely, I think, resolved with the presidency that there was consultation. The fact that people are not happy with the way the council has structured it doesn't mean there wasn't consultation. On the issue about fees, that was the other area where largely there was an argument that the fees are too expensive, that it needs to be reduced. The council initially had a fee of 1,000 Rand, and they've now reduced that to 500 Rand, so that it's much lower. I should say that the associations collect a comparable amount from their members as well. So if you benchmarked against that, this amount doesn't seem to be exorbitant. So those were the key issues that the presidency raised. We then prepared a response. I sent that through to the presidency, and now it's a matter of them finalizing this with the certificate so that we can then proceed to finalize the regulations as such. I'll stop there, Chair. Thank you.
Thank you so much, Dr. Pillay. Chairperson, I know you can divide labor because the questions they vary, and I believe you have got chairpersons of committees. You can do that and also allow the acting registrar to speak. Then you will be the last one to speak. Over to you, Chair. Mr. Mbezi, you want to speak on technical questions that relates to your technical area of work? I see your microphone is on. You can proceed.
Okay, thank you.
Okay.
Oh, you finally managed. There you go.
I finally managed. Good morning, Chair. Honorable Chair. Sorry for that. Good morning.
Yeah.
Thank you so much. I think, yes, we can hand it over to the acting register, but also with other members will follow as well. I'm not sure through you, Chair, that Mr. Mbezi can start. Maybe we'll ask Mkhulu Ntanga to follow, and Mkhulu Malachi as well. Thank you, Chair.
Thank you, Honorable Chairperson of the Portfolio Committee and my Chairperson of the Interim Council. Let me start with the issue raised by Honorable Mutuwatsi on the issue of the interim status of the council. the interim status of the council is the issue that is in the legislation. The Traditional Health Practitioners Act provides only for the interim Traditional Health Practitioners Council. I think with this one, I will also be responding to the question raised by Honorable Litlape on the issue of why the council is not appointed for a term of 5 years. So the legislation does not provide for the transition from interim to permanent council. Hence, what the department is doing now, we have got a amendment bill, Traditional Health Practitioners Amendment Bill, that the department is trying to facilitate, which will be going to Parliament very soon. So in that amendment bill, we are also actually including that this council should be legislated as a permanent council, and then should also be provided a term of 5 years. The 3-year term is only attached to the interim position of the council. And then the other issue is that India and China actually are quite advanced on the issue of traditional medicines. That also talks to their historical background and also our historical background. That is why we are now trying to do an operation catch up with China and India. But what we are also trying to do, we are following the guidance by WHO. The World Health Organization has been issuing traditional medicine strategies for some times. The one that we were actually following in trying to actually develop legislations and also policies that I've talked about was the traditional medicine strategy, which ended in 2025, which guided us in drafting the draft policy that we are having. And I must also mention to honorable members that the department is quite in an advanced stage of approving the policy on traditional medicine within the department. The policy is currently on its way to the Tech NHC for a recommendation to be placed to the National Health Council for approval. So we do have a draft policy on traditional medicine, which is aimed at including the traditional health practice within the national health system. So that policy was drafted following the guidelines provided by WHO in those strategies. Currently, the WHO has also launched a traditional medicine strategy 2026, which is running for the coming 10 years. So we are also actually being guided as the department by those strategies and guidelines developed by the World Health Organization. So coming into the question raised by Honorable Leroux, where the question was asked, where does the Customer Initiations Act belong? The Customer Initiation Act is administered by the Department of Traditional Affairs. Hence, we are in collaboration with the structures established in terms of that legislation. The other question was, how do we ensure that the 300,000 Traditional Health Practitioners Council could be contacted or could be made aware or could register with the Traditional Health Practitioners Council? In terms of what the department has done, I think members will remember that the department also has got provincial Department of Health and also district structures for the Department of Health. So what we have done as the department, we have mobilized traditional health practitioners along those spheres of the department. We have drafted a communication strategy for traditional health practitioners, where we mobilize traditional health practitioners at a sub-district level, and we established a structure. We also have a structure established at a district level, which is a district a structure representing traditional health practitioners in that district. And we finally had the provincial structures. So we do have a simplified communication with our traditional health practitioners in provinces. And then we have partnered with the council to say that whenever council wants to go to provinces or want to pass messages to traditional health practitioners, we can also use these structures established by the Department of Health to assist in conveying the messages. And the issue of research activities, we do have several universities that are actually involved on researches done on traditional medicines or products that are derived from traditional medicines. Actually, this is mostly facilitated by the Department of Science and Innovation. The Department of Science and Innovation has got a legislation which is called the Indigenous Knowledge Systems Act. I think within that legislation, they are also facilitating activities of research derived from indigenous knowledge. And they are also funding several universities. They have also funded a laboratory with the University of Free State, which is the state of art laboratory that only deals with researches on indigenous knowledge systems. That project is actually run by or headed by Professor Mutlalipule Matsavisa of the University of Free State. They are also funding other research activities with the University of Pretoria, University of KwaZulu-Natal, University of Venda, and several other universities. I also happened to attend the meetings on those platforms, and there are several products that has already been developed with the challenge that they are having, that the products can currently not reach the market because they have not yet been given authorization by SAPRA, which is currently a problem because SAPRA does not have a unit that deals with regulating products that are derived from traditional medicines. But we have been informed that SAPRA is currently establishing that unit, and they have appointed a task team that is assisting them to establish a unit that will deal with registration of products that are derived from traditional medicines. Coming to the questions raised by Honorable Clark, the issue of the APP and the annual report, I think we are currently exempted from submitting those because we are an interim council. But I think the department can also maybe come in and maybe give clarity on that one. The delay in the register and also the CS, I think Dr. Pillay has addressed that. I would also like to actually emphasize or bring this to the honorable's attention that we currently don't have a register at all. Currently, we don't have any traditional health practitioner in South Africa in terms of those categories who has been registered. Hence, we were indicating that we are not fully operational and we are still waiting for those systems to be purchased. And also, the most important one is that we don't have human resource capacity. Hence, we are also requesting that the priority posts that we have identified should be actually being recruited and appointed in terms of that tender that I have indicated. Response to questions raised by Honorable Litlape. The issue of the 3-year, I think I responded to that. The acting registrar, Dr. Pillay, has responded to that. And the issue of the representative of the nursing council, it was also raised mostly in our consultations when we were consulting the amendment bill. And then on the amendment bill, I think there's a recommendation that the nursing council should also maybe second someone to sit in this council. So that one will be taken care of in the amendment bill. The systems, I think that one for the systems, I can maybe reserve it for the department. Maybe they can respond to that to say why didn't we use systems that are already available from the Pharmacy Council or the Health Professions Council. Honorable Chirwa Mpongose, I think most of the comments that you have made were noted. And then also the issue of the infrastructure currently existing in provinces. There are currently no infrastructure. And what we are intending to do in regulating, because Dr. Pillay has indicated that this council's mandate is to regulate the individuals and their practices. The only thing that we can do is to provide for a standardization, maybe of the facilities that the traditional health practitioner used in their respective areas, and also standardize the manner in which the practitioners themselves has to operate within. There's no any intention of currently having a facility which is actually built specifically for traditional medicine practice. What we're trying to do is trying to improve on what already existing traditional health practitioners should practice in their own space, in their own indumba. They should be afforded with their own privacy there. And then the issue of fully independence also it's awaiting the final proclamation of the amendment bill that we are trying to facilitate or process. Bogus traditional health practitioners, actually this is why this legislation has been passed, because nobody knows who is a real traditional health practitioner, who is a bogus traditional health practitioner on the ground. Registration with the Traditional Health Practitioners Council will actually assist in trying to curb the mushrooming of bogus traditional health practitioners, because we've got a problem actually for people coming from neighboring countries, when they arrive here, suddenly they are traditional health practitioners, and then they have not been practicing in their countries of origin. And then those are largely people that are performing things that are actually not acceptable within this practice. So hence we are saying that this legislation will also assist in actually registering traditional health practitioners and curbing the bogus. So one of the things that maybe we didn't indicate when we were introducing the council is that most of the people that are sitting here in the council are trained traditional health practitioners. The Act requires that a person who's supposed to be appointed by minister to serve in this council should be in practice for a period of more than 5 years. So we are sitting in this council with experienced traditional health practitioners. Hence, they will be the one leading and advising on the policies and other guidelines that this council has to develop. The issue of SAPRA, I have indicated that SAPRA is currently establishing a unit that will deal with licensing or regulating products that are derived from traditional medicine. And the issue of the university and research, I think I've talked on that one. The CRL dispute, Chairperson, I think we will have to sit down and actually package the details of the dispute as you have requested, because it's a very serious one. We tried actually initially to establish a better relationship between this council and CRL, and we are still willing to continue paging and establishing that relationship going forward. So we will comply and package the dispute as we have reported. The concerns raised by Chairperson, I think the CRL one I have dealt with. The delay in the reappointment of the registrar, Dr. Pillay, dealt with that one, and also the CS. The bogus THPs, I think I've clarified that one also. Yes, actually the program that we will embark on registration, actually we have started with a roadshow. We have started with partnering with the structures established by the Department of Health or the Directorate Traditional Medicines, and then we will continue going forward. And the last one was on the medical certificates. The issue of the medical certificates, I think the Department of Labor also has reached out to the department, also trying to get the progress on the issue of registration. They are waiting for the registration to commence, so that they can also amend their policies and guidelines accordingly in terms of traditional health practitioners who are registered with the council. So we are in contact with them as the Department of Labor. Then we will inform them immediately when registration begins. Let me stop here, Chairpersons, and give other members of council to provide the responses on the questions that were raised. Thank you.
Thank you, Registrar. Can we get responses from the other members as delegated by the chair, please? Can we do that?
Thank you, Chair and honorable members. I won't go far. I think the registrar has covered most of the things. And without wasting the time of the members, I think the issues that were raised, I think the first question that was raised was with regard to the existence and sustainability of the council on whether are we achieving the purpose. I think the first member, it was Honorable Bushome, raised the issue about preservation of the traditional knowledge system. The first issue is that I think the speakers that spoke before me, including the acting registrar, as the council, we exist as the council, but we have got no operational structure. So basically, there's nothing that can be done until you have the operational structure that will be able to execute what should be done. Secondly, in so far as the registration of the traditional health practitioners and everyone else that falls under that, if the regulations are not promulgated, there's nothing that can be done by the council, because the first step is to ensure that we have the regulations promulgated. And once the regulations are promulgated, then you start the process of regulations. Thereafter, you will start implementing what is required of you as the council in terms of the legislation, the functions of the council in terms of the legislation, making sure that you issue appropriate guidelines for the traditional health practitioners in terms of how they operate in their areas of expertise. I mean, Dr. Leroux mentioned, a significant issue in terms of ensuring that we guard against harmful practices towards the members of the public by dispensation of medication and also by treatment of members of the public. We, as long as we don't have the members that are registered and we are able to regulate them as the council, because we don't know who is who. So that is the first issue. The other issue that we need to consider that was dealt with is the issue of the funding model. The funding model exists in terms of legislations is twofold or threefold. One is the appropriation of in terms of funding by Parliament, and secondly, by levying fees to the members of the profession, that is Traditional Health Practice Council, issuing of the penalties and any other means. So that is the existing funding model. We're hoping that once we start the process of registration, we'll be able then to raise funds and start to grow and slightly become independent of being funded through government. Hopefully that will be a success. But the legislation still covers us in the event that we're unable to raise adequate funding from registration process. It's not going to be an easy process. And traditional health practitioners have been existing for many, many years without paying membership fees or registration fees. So it's not going to be something that will be easy at the beginning. The other issue then is then we start regulating how the practitioners are conducting themselves within the practice. So we have to do all of those things. Then the issue that seems to be also raising the eyebrows of the members of parliament is the issue of the CRL. I think, Chairperson, it was yourself or Honorable Member Chiron Bongose. It may seem that the issue of the territorial battle between our council and CRL, but that should not be a serious issue. In the last meeting that we had with CRL, we had an agreement and understanding that we'll meet again, we'll continue meeting, and even when needs be, we'll even develop a memorandum of understanding on how we cooperate with one another. And as creatures of statute, we go into our legislative, enabling legislation, identify the areas where there may be overlaps, and try and see how to work together. And I'm sure and I'm positive, Chairperson, that that can be resolved. So that should not be an issue that should really raise a serious issue with members of Parliament regarding how we operate and the possible dispute with that. And we intend doing that with many other existing councils and health institutions, and we are collaborating. We're trying to collaborate with as many, but insofar as making sure that we fulfill our mandate in terms of legislation, we are definitely trying to be on board in doing that. But as long as we don't address the issues that are teething issues, regulations, and establishing operational structures, council will not go far. But we are hopeful that processes that we have done, including the policies that we have developed and approved, to ensure that when we have the staff, operational staff employed, they hit the ground running with already existing policies, regulations, and everything. Thank you, Chair.
Thank you. Any other person who wants to respond? Oh, yes. Over to you.
Yes. Chair, thank you very much. I think my colleagues and the department, as well as the AR, have said a mouthful. But I just want to raise a few issues with regards to what we have in the country. We have an estimate, and this estimate has come a few years back, of 300,000 THPs. And we are seeing these numbers that are increasing on a yearly basis. One, we also have THPs that have been practicing forever. And as a result, we are treading very, very carefully in the space in making sure that we understand what exactly we are doing in terms of regulating, training, and all those things. But what is also has been important for the council has been engagement. We have done the road shows, yes, with very much limited budget. But with that limited budget, we have done the road shows to all 9 provinces, engaging with communities, stakeholders, and the departments of health in the provinces, just to make sure that we can explain to people why it is important for this council to be there, but also why we also need to regulate. We have many of our THPs on the ground that are feeling like it is time that our African traditional medicine is taken importantly, as well as in line with other medicines. They want to register. And we are seeing quite a lot of non-charlatans in the system. But we are also seeing many people who are against registration, either because they are benefiting somewhere, somehow, and others because they feel that they do not have the prerequisites to be part of this. So it is a battle that we are on. We are engaging with people who are now saying no regulations in the country. We are saying, we're having people who are saying you cannot regulate the spirit, but we are not trying to regulate the spirit. We are just making sure that we can protect South African public and make sure that every single member of the public is touched with respect and dignity. So we are doing that. It is very important, Chair, also to mention that we do have financial constraints. As you have seen in the presentation, I think in our first financial year, we had just below 3 million as the budget. That is not enough to do all the consultation and the consultation to the likings of the THPs in the country. So I think that those are some of our constraints. We are doing all we can with the help of the department in terms of media statements, in terms of going to the media institutions like radios and TVs to educate people about regulations and to educate people that the regulator, it is not an association and is not an equivalent of an association, because what we are finding is that associations are also a little bit worried that the regulator would then be stepping into their turf. So as a result, there are some that are encouraging some of their members not to register because they will always represent them. So we are dealing with those kinds of constraints. In terms of making sure that everything works nationwide, that's why we have identified that we need 61 posts in the office of the council, the administrative staff. And in that administrative staff, we've also then considered the provincial people that will help in the provinces and all those kind of things. But we also have memorandum of understanding with the department, because the department has the African Traditional Medicine Directorate that is also dealing with the MECs in the provinces and have a bigger database of the traditional health practitioners in the provinces. So we also want to make sure that we can utilize that, because some of the nine of our council members come from those structures. So it is a very, very hectic space that we are trying to navigate and maneuver in. One of the things is this is a spiritual space that we have to tread carefully and respect it proper. We are also benchmarking, as my colleagues have said, with other councils. However, as Honorable Chiwara has said, is that it is also difficult with regards to the pricing. Because the THPs in the country, that 300,000 and more, are not earning the same across the board. Some are in the deep rurals where their income is very much limited, and some are in the cities where the income is a little bit more, and it is difficult to get a national benchmarking on that, or a national blanket to say everyone should not pay or everyone should pay. However, in the Act, there is a provision where if someone apply not to pay, the council can take that into consideration and suggest that to the minister to then let those that are destitute not pay that fee. On that note, I think we have covered some of the questions, and thank you very much, Chair.
Dr. Play, there was a question that was referred back to you by the acting registrar. Can you deal with that? And then before that, there's Rampelane. Are you part of the council members?
Yes,
yes. Good afternoon, Honorable Chair. In fact, my name was skipped when the council was introduced. I'm not sure if my video is able to do me favors by showing my face.
We can see you.
Thank you very much.
You are you the departmental representative in the council?
That's correct. That's correct.
Okay. Sure.
Yeah, just few points really. If you allow me, I can switch off my computer just to my video just to
not
allow
your computer, your video, not your computer.
That would be disastrous. That would be disastrous. Honorable Chair, just a few points to say. We, as a department, we haven't stopped talking to and about and with the traditional health practitioners. The former Minister of Health, Dr. Joe Pasha, in fact, convened a summit of all traditional health practitioners over 2 days, with the sole purpose of talking to them about anything and everything that they had raised. And pertinently, the areas of tensions at the time were in the areas of conflation of the role of the council and the role of the associations. And maybe the Honorable Dr. Lekape may be interested to hear this, and I'm not excluding others, but maybe Dr. Ru also. We brought in examples of how SAMA exists alongside HPCSA, how DINOSA exists alongside South African Nursing Council. We went at length of saying the associations can never replace the council, because associations represent the interests of members as members that are practicing, whereas the council's role is to protect the members of the public who are mainly the users, so that they don't get into trouble, as Dr. Ru has mentioned. We continued with that kind of dialogue, and we didn't stop since then. The reason we established the department established the forums on the ground, or the forum on the ground, was to create a connection from the lowest level where a traditional health practitioner sits up to the national level, so that there's no disconnect between levels or even among levels, whether it's for information flow or it's just for being able to get to see with a clear line of sight up to the end part of where every traditional health practitioner sits. Maybe the issue of traditional surgeons, as Dr. Ru has seen, the council took a resolution and delegated a member of the council to sit as a member of New York, which is where the matters of traditional initiation are discussed under the leadership and stewardship of the Department of Traditional Affairs. And that member sits there and is able to account for us. So therefore, the traditional surgeons who will then be members of registered with the council, would be on the register when the register becomes available, will then have that kind of representation. Therefore, any malpractices or malfeasance, if they do happen, they'll then be recorded and reported up to that level. Yeah, so those are just the 3 points that I wanted to reemphasize, Honorable Chair, as actions that were taken and continue to be taken to make sure that there is a good and sound relationship with the people on the ground. And as Dr. Malaji said, I wish somebody could assure the associations beyond us to say the council has got no contest with the association, because the distinction is in the functioning and the mandates that they derive. And the council derives its mandate from the Act of Parliament. Thank you very much, Honorable Chair, and over.
You see these issues that you are raising, and you have got a founding legislation that talks about the object of the council in Section 5, and the function of the council in terms of Section 6. And then listening to the responses, you're getting me more worried, because it's like you are so apologetic in doing what you are supposed to be doing. Treasury has been allocating funds to you as per that slide throughout. Then you tell us that you are waiting for the systems registrar. I get worried because by now it's a council. Even if it's a manual register, you could have done that. Because where I'm seated now, I'm trying to understand with all these allocations that have been incremental over the years, what is it actually that you have been doing? Because the issue of the register was the most key. That's part of your core mandate that also determine your existence. Yeah, that's my personal observation on this matter. Unless somebody convinces me this is what we've been doing, because honestly, you can't be having people who are just practicing all over. Maybe that's the reason why now the CRL Rights Commission is behaving the way it's behaving. Because yes, I understand the rationale it being an interim council, but that's what the Act says. I think there was reasoning to that effect, because I think considerations were made to say you cannot be checking a background that majority of you are coming from the rural communities. That intention of you being an interim council was solely for government to give you support so that you get supported by the same government. But that didn't exonerate you from implementing the actual your founding act and the other related acts. So if we are be told that there's no register of and then people are doing as they wish, and this act, like I indicated, it impedes and on other legislation like the Basic Condition of Employment Act. In so doing, we'll be doing our people injustice. So in simple terms, the things that I want to get from you, Chairperson, what is it that is tangible, apart from your appointment, that out of the act you can say, these are the things that we have done since we've been there since 2014. So those are the concerns that I'm having listening to you. But let me get those members, because we will, who needs to make follow-up questions if they're there on based on the responses. I will allow them to do that. I see the hand of Honorable Mduat and DDG. I'm worried about the previous speaker. He has now, since after talking to us, left the meeting. Can you call him to come back to the meeting? Yes, the since left the meeting. After talking whatever he was talking to us, he then leaves the meeting. That's ill discipline and it cannot be accepted.
My apologies, Chair. It's me.
You're using
My
two
battery was
gadgets.
running low. My battery was running low, so I was
Okay.
transferring to another gadget. My apologies.
Okay, thank you. I was getting worried because I saw you
No, I
leaving.
won't do that, Honorable Chair.
Okay,
Thank you.
sure. Honorable Mutuwatse, followed by Dr. Litap.
No, thanks. I think you have summed it very well, Chair. That's exactly what I was going to say, because in being interim, they are not helping us to move into a permanent structure. And exactly what I said when I started, that it seems members of the council enjoy being interim perpetually because they benefit. Because there's no impact that this council, it's very painful. I'm saying this with a very heavy heart, because currently we can't, someone says we have 300,000, there's an increase. What are you doing about it? People are dying because of these bogus practitioners. And we did this with the intention that we need to curb this practice. It is very frustrating. Now we are getting the council says, no, look, is the department, we don't have a budget, we don't have this, but we know that money has been going in there. Now we are told that we are dealing with the bill, we've never seen it, we don't know where it is. Chairperson, it is very, very, very frustrating. I'm very frustrated with this council, to be honest. I have nothing more to say. I think we just have to go back to the drawing board. That's why I was asking, what is the impact assessment that was the, the impact that could inform the minister to extend the term of this part? And by the term, I'm quite clear. I'm very clear on what I'm saying. I'm saying the term of this warm bodies that are sitting there to extend them. Because for me, I'm talking to them because they've done absolutely nothing to help us. And that's my frustration, you know. And they misconstrue that, no, look, I'm saying that I'm very clear on what the act is saying. I think these individuals are not helping us, to be honest, Chairperson. And that's my frustration. Because currently we should be having at least something that is tangible that says we have so many people. This is what we are trying to do in terms of the registration. These are the rules. And of course, the CRL come into their space because they are actually sleeping on on duty. And that's my frustration, Chair. I think we'll just have to take it up on another level to see how we review or reset what this council is doing. Thanks, Chair.
Dr. Litape, over to you.
Thank you, Chair. My comment suggests that, I've always wondered whether we're trying to, is it a round hole square peg or square hole round peg? We can't just extract what is being done from colonial structures like you have in HPCSA or other structures that are based on Western medicine. So I would urge the council not to come up with a prescription that this is how it's done in orthodox medicine, so we're going to follow the same route. See the associations as a resource and how it can be utilized going forward, so that they are part of the solution rather than being treated as part of the problem. If you go into the history of the medical issues, things were developed in the associations. The ethical codes of the medical profession come from the associations. They don't come from the councils. They come from the World Medical Associations. They were developed post the behavior of doctors in the Second World War in Germany. So I would ask that we should not be close-minded in terms of how we're doing things, because we're not getting anywhere quickly. And if you embrace and bring the associations closer and come up with a system where the associations are turned into the boards, like we have in the Health Professions Council, so they are still a part of the values of the profession, training of the profession, and they inform the rules of council, you're going to go ahead quicker. So there has to be a place where it's a unique solution from what we've learned in terms of how orthodox professions are governed and what happens in other countries, and we create a roadmap unique to us as South Africa, Chair. Not this issue of saying, but this is how it is done in the HPCSA. No, those are orthodox issues where training programs have been sorted out. We're talking about a complex issue, and we can't come up with a simplistic transference of what's done in Pharmacy Council or Nursing Council or Health Professions Council, and we transpose it into this council. So we require serious thinking, serious engagement, and bringing the diversity together. Thank you, Chair. Chair, one other thing that you've mentioned, Chair, that is important. And you've mentioned it, and I hope you'll take it up. We need to know where COCTA fits into this. There can't be a parallel structure that is aware. There must be an engaged structure. Because when you look at the issue of traditional circumcisions, COCTA is as involved, if not more involved, than the Department of Health. So we need to bring all the government structures, constitutional structures, and parliamentary structures together to forge a way forward on this. Thank you, Chair.
The other thing that I think DDG Pillay, as they were presenting on the allocations, I'm still to see their annual report published. I think one colleague raised that. And also the financial statements. How have they been performing at DDG Pillay? And that I know it's published and it's shared with you, shared with you via the minister. So these are the matters that are of interest, because next time when we reconvene, we'll have to see that. Yes, the reason why the Act says you are an interim council, there was a reason, so that you are able to be well established, as I've said earlier. But being that you have been in existence, as I've emphasized, since 2014, and then then by now there's no enforcement mechanisms, the way you say it. More so than people, that's why there's a lot of them. I just want to emphasize that, because it's a matter of concern. Bogus, fraudulent practitioners, and then also the issue around because that's why we said we want your financial statement, so that we can also relook at your funding model, to also check how have you managed, if there are measures that you've put in place to prevent financial mismanagement. And then also, because the reason why you're an interim council was also for you to also then develop a long-term strategy for building a fully functional and sustainable statutory regulator. These are the things that we didn't hear in your presentation, and I will elevate this. I should think in our next meeting, we'd like the minister to be part of it, DDG Pele, because really you were a creature of a statute. And there was reasoning why this act was promulgated, enacted also into law. It was solely to cater for this. Yes, it's happening in other, and I know there was benchmarking and the like. Because where I'm seated now with all those responses, I was expecting so much. Maybe it's just because I was expecting so much from the council. I'm much more worried than I was before, colleagues. And I think this is the matter that you need to go back, a chairperson, and take it in good faith. We are not negative people. We just want to ensure that the structures that are put in place are functional. And yourself on this end, your recreation of a statute, that's where it's our biggest worry as the legislature, to say that then if then a statute has been created, and then what the objective of the statute is not realized, ourselves as legislators would get worried. We get worried, Chair. We get so much worried, because we are also asking ourselves to say, over the years, you have been there, the minister also, maybe we need to also ask the minister this question: what made him to then also even deem it fit to renew your contracts? Because those 300,000 people that my good Dr. Malaji talk about that, because also if you read the act, it has got a provision for penalties and enforcement. They are there, they are on their own, whereas there's a regulator that's supposed to regulate them. So I think also maybe it's the focus to say you need to look at your core business as a council, as I'm closing on these matters. But we are going to call you. Also, we'll have to get the department to say, we need to look at how have been your annual reports looking like. And also in terms of your financial statements, how have you been performing? And then also, when you come back to us, you must come with that long-term strategy that we're asking for the sustainability of the council. It can't be that you are there and then the people, because you are acting in the best interest of the public. That's why you are put in as a regulator. We've got so many people who are victims of these bogus traditional healers. And even registrarily, we're proud to even say that there are people who are coming to the country who are then, it's the people's life that are lost. It's our people, communities that get vulnerable under the circumstances. And it ends on you telling us, registrar, that they are here, they are bogus. But what are you doing as a regulatory body? So these are some of the issues that our first engagement with you is for today, but I should think you must know that we are going to call you moving forward so that we have got so many unanswered questions. And I know I'll employ members because of the time. They are going to send me questions, Chairperson, that you'll have to respond to. Because if we don't do that as members of parliament, we'll be failing our people. And that's why I emphasize the CRL Rights Commission. It has realized this vacuum. You are supposed to provide this requisite leadership as the council, and you are not doing that. And maybe that's the reason why you find this mobilization. And as we close, Registrar, you must give us those issues that you are saying to support this thing that the CRL Rights Commission is mobilizing against the Traditional Health Practice Act. I think if I were you, dear colleagues, it would have been an important moment to say, let's then work hard to represent our constituencies. Let's make sure that we also work hard to protect our constituencies who are traditional health practitioners, and also make sure that we regulate in the best interest of those practitioners, including their clients, their patients whom they see on a daily basis. So I think I need to part with you at that end with the view that you are going to go back to the drawing board. And that's why we are saying we want to call the minister also to come and tell us, because it can't be that Parliament created this statute and then it just gathered dust. Only a section, that is the appointment of the council, it's only implemented and the rest of the act is not implemented. We are so worried as members of Parliament, and I hope we will deal with that. Who's raising the hand? Let me see. Yeah, I was going to give you an opportunity to close, Chair. I'm coming to you now. Okay? You are parting short, Chair. You can talk now.
Thank you so much, Madam Chair and the committees. But maybe to clarify an issue, we are all, this council that we are speaking with today, it's only 3 years. We appointed in 2023. We're not there in 2014. We only started in 2023, meaning we have only 3 years as this council that we are speaking to today. And we don't know the work of the council on which was appointed in 2024. We don't know. We don't have that. It's not so long that we've been appointed, Madam Chair. It's only for 3 years. 2023 in April. We agree with you that it has been too long. 19 years being interim. It's quite a long time, which it's also a concern to us. However, as I say that we are only 3 years in the office as this council that we are speaking to, not 2014. So as we say that we've managed, as we come in 2023, managed to have these 24 policies that we've come up.
I'm sorry.
So sorry, President.
Yeah, I'm sorry
I
to do
didn't
this.
say that since 2014 is where you were established. And you see, when you get established, I'm going to give you an opportunity. Let me address the chairperson.
Okay.
When you get into in the institution, you don't just get in and sit and you're not interested what happened in the past. It doesn't happen like that. How did you do your situational analysis? How did you do your planning, your strategic planning? Because the institution exists. Me now where I'm seated, we are talking about when were you established. That you were appointed in 2023 is another thing. And even if it's 2023, we are in 2026 now. 23 years later, Chairperson. And is there anything tangible that you can show us? Your presentation doesn't say anything, if I'm to be blunt, to say this is what we have been doing. Because you see, this presentation was supposed to be talking about how are you implementing the act. The Honorable Mutobasi?
I think, Chair, you have covered me, because I think, with due respect, the chair is out of order. You have covered me, Chair. Because when you take over office with all its failures in the past. We can't come and claim here as members of the first seventh administration and say, no, we disassociate ourselves from everything that happened since 1994. We can't. Thanks, Chair.
Thank you, Chair. We welcome your counsel.
No, wait. It was going to be simple for you, Chairperson, to say, we hear you. We are going to mend our ways and make sure that we do what is expected of us. Yes, the council was established in 2014. Unfortunately, you are part of the history. You are here. You are the people who are holding the fort now. And accountability doesn't stop because it's about the council. So close your meeting and so that we can go to the next item. Sorry.
Thank you, Madam Chair. We welcome your counsel. And as you've just alluded in terms of what is expected from the council, we will be preparing what you're asking us to do and coming back to the to Parliament also to present what you're asking us to do. And we thank you for giving us this opportunity, and we are learning to be able to present the work of the council. Where there are gaps, that there are really serious gaps that we have identified, we hope those gaps, as we come back, they would have been able to be closed. And thank you so much to all members. We are striving to protect and promote Indigenous healing. We may not have a tangible to say this is what we have done, but we sit in different committees like the expert working group on traditional medicines in the country to advise the minister on issues of African traditional medicine. And also we participate on days that promotes and protect traditional medicine, days like the 31st of August, which is the International Day of Traditional Medicine, where we also forge a working relationship with departments that have anything to do with African traditional medicine and practices. But with what you have guided us to do, we will also ensure that that's what we do. Thank you, Chair.
Excuse you with this word to say you hear the overview. We are going to send you additional questions that must be responded by next week, Tuesday. The Secretariat will collate those questions as members said they've got some questions just that for the sake of time, then they couldn't raise all those issues. But I hope you heard our message, which is very clear. The next time when you come back, you'll be talking to the specifics of the work that you've been doing. And definitely there are 3 annual reports that you have produced during your tenure. If not, you will be in the process of producing the 3rd one. So I think we'll meaningfully engage with you on those ones, including your strategy, and then also, the annual reports that you could have produced, because you have to do that in terms of the law. That also to look at your financial statements. So we want to thank you all, Chairperson and the members. Before I do that, I see the end of Honorable Leklape.
Thank you, Chair. I've heard us mention that the function is to protect the public. That is not your only function. Your other function is to guide the professions. So your function is both guiding the profession and protecting the public so that you can take steps against them when they're out of line. That's why the relationship with the association is critical and needs to be cemented. Thank you, Chair.
Okay. The act is very clear, Dr. Letlape. If they're to go to the act in particular, I think section 456. The objective, their functions, those things that you are raising, they are there. So let's take this opportunity to thank you and excuse you with the view that we are still going to engage with you. This engagement with you is going to be ongoing until we get things right. Yeah, you are excused, and then I'll remain those other ones that need to remain in the meeting so that we complete this further business of the committee. Thank you, Chairperson, and thank you all councillors that came to attend the meeting.
Thank you, Chair.
I can see you, Honorable Masuku, from Gauteng Legislature. We also want to thank you for gracing our meeting. Thank you so much.
Thank
I
you.
know your interest on health is immense.
Thank you, Chair.
Thank you, Chair.
Yes,
Thank
they are
you, Chair.
going. Thank you.
Now I can leave, Chair. Thank you.
Yes, you can leave now that the meeting is over. You are excused.
Thanks very much, Mother.
Thank you. Let's then flag the agenda item for the remaining agenda items. Secretariat, is it minutes?
Yes, Chair, it's the
Okay. Yeah, we had a meeting with the South African Pharmacy Council on the council's mandate, regulatory function, and its current priorities, including its role in regulating pharmacy education and practice. Those are the members that were in the meeting. Check if your name is omitted and let me know. Then the apologies were from Honorable Shiram Pongoze, Honorable Van Staden, PA, and Honorable Zungola. And our support staff, they were all there, full houses always. Then the department delegation is there listed.
Sorry, Chairperson, are you counting me in?
You were in a meeting. Are you not there?
Yes, I'm there.
Yes, you were in the meeting. You were there.
Okay.
You are written
Yes.
there. You are there.
Yes, I'm there.
Okay, honorable member.
Okay, thank you.
Thank you. So let's go to the briefing. I'll allow members to look at the observations now and see if all your inputs, comments were adequately attended to. Okay, let's move to the next page. Then there were any other business meeting. I liked it in fostering the unity in the committee. Those debates were robust, and thanks. I will always be open to such time and again. That's how strong teams are built. So that's the meeting. Can I get a mover and a seconder for the minutes as a true reflection of what transpired? Honorable Clark.
Thank you, Chair. I move to adopt the minutes.
Seconder, Honorable Mushomi Mutubate.
I second, Chair.
Thank you so much. What is the next agenda item, colleagues?
Sorry, Chair, what was that?
The next agenda item, are we done? Are we exhausting our
It's
agenda?
the closing remarks. We are done, Chair.
Okay.
We
Yes,
forgot the brief on the study tour.
you sponsoring it. We'll discuss it physically next week in a meeting in Parliament. We've got a meeting next week. I think the team now is no longer overwhelmed. They will be able to. We are done with the budget. We are done with the APP, safe to say the normal business of the committee. We will then be able to talk to it. But I think there was a proposal. We can even close here to say whatever we do, we must go on a study tour after the election. But let's discuss it. I got those proposals because now we are already on the election mode. But I'm up to persuasion because post the election, there's a week there for constituency period or oversight. I think there's something like that. But let's discuss it fully in the next meeting on Tuesday. We are going to discuss the quarterly progress report for the department. I wanted to ask a secretariat if it is possible. There is that entity for mining. What is it called? If we can also include it for the progress report, that will be the fourth quarter progress report for the month ending 31 March 2026. If we do that, then it will be paving a very good way for us when we will be dealing with the annual reports. I think around October, August, if I'm not mistaken, at that period. So we will be meeting physically on Wednesday in Parliament. She's busy looking for the venue, the secretariat. So those are some of the issues. But I think as I close, I want to thank you, colleagues. I know majority of you belong to other committees. I know that. But I was taking advantage of the fact that majority of you had already confirmed attending the meeting with the Science and Technology and Innovation Portfolio Committee on that ASAF report, which the meeting was later postponed at the instance of the other chair. So that's why I just felt let's meet today. Secondly, because I've extended an invitation to all of you for the webinar that is taking place on the hypertension in UKZN tomorrow. So hence the meeting had to be moved in today so that those of you who will be attending will be able to attend that webinar, that seminar tomorrow at UKZN. And also just to remind all of you that Thursday is the budget vote for Parliament. It will be nice if all of us as members of the committee also attend the budget vote for Parliament physically. I'm told it's held at the Dome. So that's all on my side. That's all on my side. Unless if there's any other thing that members want to raise. Honorable Clarke?
Chairperson, I just wish to put my apology in for tomorrow. I was in quite a bad car accident, and tomorrow morning the assessor is coming to look at my vehicle. And then over and above that, I am on duty as a whip this week in Parliament. So I have to be in Parliament tomorrow and on Thursday. And then, of course, the debate on Parliament, I'm sure all our political parties will tell us it's a 3-line work because we get told that. Thank you, Chair.
On my side, we are already told that is a 3-line whip. Okay. We're done, colleagues, unless there's any other things that you want to raise before I close the meeting. Safe to say, we need to convey our well wish to Honorable Tleko, and then a message of condolences to Honorable Kumalo. Let's keep them in our prayers so that our whip gets well soon, also including Honorable Kumalo, as they will be burying their loved ones. Honorable Litlape, before I close, over to you.
Yeah, Chair, my question was, when are we re-engaging with the Health Professions Council of South Africa?
We'll put it in the next start to suggest what we need to do for the next term. We are almost towards the end of the term now.
Remember, we had said
Yes.
with them that we will follow up with them now, not in the next term. There were issues, particularly the issues about international laws that require urgent change.
Okay. Are you amenable to a Zoom meeting after the plenary?
I'm just saying it's something that we should not forget, that we need to get in touch with them, and it's probably responsibly before we go away.
Okay. I know that. We'll see how do we work on that with Menko and the secretariat to that effect, so that we make sure that we meet them. Also now with this current council, because they are the umbrella body, I think there are questions we need to ask them based on the two statutory council we met with, the pharmacy council and the one that we met today, because after all they are the umbrella overall body. And then the secretary, she sent me a message, she's proposing that we call them for the 25th of June. That helps, ne?
Yes, that helps, Chair.
Sure. Thank you so much.
Thank you.
In the absence of anything, I wish you well, good health, all of you. Let's keep the two colleagues in our prayers. The other one, Honorable Tleko, that she recovers, and the other one, give her the moral support as they will be burying their loved one. Thank you so much, colleagues, and I sincerely appreciate your attendance. At some point, Honorable Leroy was worried that we're not going to have a quorum, but you all came. And one always appreciate the support, the hard work, the dedication that you colleagues you have put into this work. It's heartwarming. I think we'll get this thing right as we move forward. Thank you once more and enjoy the rest of your day. The meeting is adjourned.
Thank you, Chair.
Thank you, Chair.
Thank you, Chair.
Are you coming?
Thank you and bye, everybody.
Thank you.
I'm coming where?
To Cape Town?
Oh no, ma, I'm still off sick.
Yeah, we sincerely appreciate you that you also then you make effort. Others will sleep in bed and say I'm sick. The same thing with our whip. The same things with our whip. She does that all the time. We appreciate you. Enjoy your day further and get well.
Thanks, Sissy.
Thank you.